Hey guys, Dr. Galliard here at the Functional Medicine Center of Fort Collins, and today I'm going to go over something that is a issue that we see all the time with people, but is totally not recognized in the traditional medical model. Most people come in with a thyroid problem and they think what? Their thyroid is the problem. But guess what? Very rarely is it just the thyroid itself. It can be a lot of different things. It can be Hashimoto's, which is autoimmune. It can be the underconversion that we're going to be talking about. There's a lot of different things that actually have nothing to do with the thyroid gland itself, but actually have to do with the thyroid hormone levels and a lot of other systems that are out of balance. So one of the things that we look at with patients is, what is the underlying why? Why is the body having these issues that it's having? It's not just, oh, my body went haywire, God struck me with a bad thyroid or whatever it is. And I see patients all the time. We review blood work, hundreds of blood works every month we see come through the office. And the thing that we see is that most doctors are adjusting thyroid hormone based on TSH. TSH is thyroid stimulating hormone. TSH is not a thyroid hormone. TSH is a pituitary hormone that tells the thyroid what to do. So what does that mean? Well, you're making a big assumption that the pituitary is communicating effectively to the thyroid, and that we're going to adjust your thyroid medication based off of what that pituitary is telling the thyroid what to do. You've got to evaluate all of the thyroid hormones, the T3 and T4, total and free. Some people just want to do free, but you have to do total and free T3 and T4. And you need to look at the Hashimoto's markers, the TPO and the thyroglobulin antibodies. Those are going to tell us, is the body attacking its own tissue? I've got some other videos on that, so if you're interested in that one, look through our catalog there and you can see all the different videos. So if you know somebody, or if you're dealing with thyroid, or family, friends, anybody at all, like or tag them in this video. It's going to educate them a lot. So remember, one of the biggest things that we see is not a thyroid problem, but it's actually an underconversion. And what we're talking about is we have two main thyroid hormones, T3 and T4. We call T3 the active form, or this is the good usable form of thyroid. 93% of thyroid hormone that's produced by the thyroid is T4. Only 7% is T3. So why doesn't the body just have the thyroid kick out a whole bunch of T4? Well, we don't want all of this active thyroid hormone floating around the body. We'd be jittery, our heart would be racing, all these different things. So we keep the T4 on hand. When we need more, we convert over to the T3, that good active usable form. If someone's taking levothyroxine or Synthroid, these are both thyroid medications, they are taking external synthetic T4. There is no T3 in that. If somebody's taking Armour or NatureThyroid or Westroid, that is a pig thyroid glandular. It's the natural thyroid hormone, and they're taking T3 and T4. So they're getting a little bit of T3 as well. But what we see for many of our patients is they actually have plenty of T4. Yesterday, I saw a patient, she came in specifically for low thyroid symptoms, and guess what her T4 said in the blood work? Even in the lab range, it said high. Her T4 was high. I said, what are we going to do? Double your thyroid hormone? Then what happens? Well, then your heart really gets jittery, racing, heart palpitations, sweating, hyper symptoms will come about, but they're still having hypo problems as well. The weight gain can't stop the hair from falling out, some of these different things. Her T3 was down at the low end of where we want it to be, and a couple of them were even low in our functional range. So she had plenty of T4, not enough T3, the good usable form. So what does that mean? We're not converting like we need to. So this underconversion, it's blocking the T3 from being able to go out and do what it needs to do. So it's basically a beaver dam has built up. I always explain it this way. You've got your beaver dam, you've got this trickle of T3 coming out down here. You've got your beaver dam, here's all your T4. And if you take in more T4, you just build that beaver dam up higher. You're not actually going to get more water coming out from underneath of it. So how do we help that underconversion? That is where 60% of that conversion takes place in the liver, 20% of that takes place in the gut. We've got to be able to get the body converting that T4 to the T3. There's specific nutrients that we can use, a lot of different things that we are going to be able to do to help the body convert more into T3. It's not a low thyroid state. So the thyroid may be even making enough T4. The patient yesterday, I'm pretty darn sure that we're going to be able to get her to a minimum dose, if not totally off of her thyroid medication. Why? Because once she starts converting the T4, she's going to have plenty of thyroid, probably even from her own thyroid gland. But she's taking it in externally because the doctors, all they see is the TSH, that feedback loop saying, hey, you need more thyroid hormone. But she actually doesn't. She needs to make more T3 from that T4. So yes, she ultimately does need more thyroid hormone, but she needs it from her own body. So this is that underconversion issue. It's pretty simple to diagnose, but in the traditional medical model, there is no treatment for underconversion of T4. Sometimes they will give somebody a Cytomel, which is T3. So levothyroxine and Synthroid is T4, Cytomel is T3, but is that fixing anything? Is that fixing the why? No. And that's where functional medicine comes in. If you're having thyroid issues and you don't know what it is and you're wondering if it truly is the thyroid, get it checked out. We can figure out, is the body converting that T4 to the T3, and we can help you figure out why your body is going haywire, because it very rarely is truly the thyroid gland. If you know someone that thinks they're dealing with thyroid issues and wants the true story, drop us a line, like, share, give them this information. We love getting out there, and we'll let them know exactly what's going on. Make it a great day, guys.